I'm Dr. Chua Yang. I'm an obstetrician and gynecologist in private practice. I work in Mount Alvernia Hospital. I think as a woman myself, I feel very strongly that women are the cornerstone of society, and healthcare will have a much better reach if we target looking after our women, because the women will look after their children, and children are always the future. So I strongly believed in that, and I wanted to specifically be in healthcare for women. I enjoy obstetric practice very much, and although it's such a high risk specialty, and you may already know the medical insurance for obstetrics is one of the highest, so we pay a huge premium to practice obstetrics. But I also quite appreciate the deep connections you get with women when you go through a whole pregnancy with them, when you go through, in fact, much of their lives with them, because it's a long, ongoing relationship, very much like family medicine is for some people. And I like that aspect of ONG practice, that it's not a surgery and then off you go and I don't see you again, but it's an ongoing relationship. And in fact, I've had patients whose daughters I've also now delivered, and then it's their daughters now that I'm also going to deliver soon. So, in some families I would be delivering 3 generations, getting very old. But that's actually an amazing achievement, because that speaks of how long lasting that relationship is and how well we get to know people through our work, which is quite spectacular. When I was applying for medical school, maybe that was still a time where it's largely a boys' club. When I went for my medicine interview, one of the interviewer, a very famous surgeon, actually was notorious for making girls cry at the time. And so he was talking about, why should we let you girls into medical school, because you're just going to get married and you're just going to leave the service and taxpayers would be wasting their money. And so, a lot of girls went into that specific interview room and left crying. And so I think that really etched in my mind. But subsequently, I do feel that in my class of medical school and starting out working, that I really did not feel disadvantaged as a woman. And for that matter, the specific field that I have chosen has become so much more popular for women gynecologists, and I think women feel so much more comfortable with a woman doctor, that I feel that it's really a big plus rather than a setback. I am a hobbyist photographer. I like to take photos. I have done a photo exhibition of my father. So there were pictures taken of my famous father and artist, Chua Yang. He has a solo exhibition of his paintings at the National Gallery of Singapore from November last year to November this year. So in conjunction with that, just end of last year, I had a photo exhibition of these photos that I've taken of him. I wanted to use that photo exhibition to remind people to connect with all the old folks at home, and to make sure that they have adequate sort of mementos of them even after they pass, that there are lots of beautiful photographs of them, the kids, the grandkids, together. And that's a really good family keepsake, I think, that gets passed on. I also like to take photographs of women and children. In the photographs, especially when I go on medical mission trips, you would see and notice that wherever you go in the world, no matter how rich or poor people are, that the way women look at their children, there's always love and there's always concern, there's always care, that facial expression doesn't really vary very far from culture to culture, from different races, different countries. Motherhood is global. That's something that hits me always, and I love photographing them. And so that's something that I consistently do, especially when I go on medical missions, and that's fascinating to me. The first time I went on a medical mission trip was when I was still in medical school. I decided to go on a medical mission to Niger on a mission trip with a surgeon, and this is a mission hospital for that matter in Niger, in the middle of the country, and this is a sub-Saharan desert country with very, very little. And when I went there, I realized how adaptable surgeons have to be in a rural setting. In that particular mission trip, one patient really, really stuck in my memory for many years, and that is the time that a woman had walked and hitchhiked for days to get to the hospital because she had started bleeding in labor. And of course, retrospectively, we knew that she had a placenta previa, so it was a low-lying placenta. She bled, and as she bled, the baby had died. But if she continues to bleed and she still doesn't get delivered, she would die. So by the time she gets to the hospital, her blood counts were extremely, extremely low. So low that she was already at the brink of shock, and there was no possibility to put her under any sort of anesthesia. So that was a cesarean section that I did under local anesthetics. So we were just injecting layers and then cutting, injecting layers and then cutting, because any sort of other sort of anesthesia would crash her blood pressure more. That was the surgery that I did in the bush, in the mission hospital, and it made me very happy and relieved that this woman eventually managed to walk out of the hospital. She lost the baby, but she survived the ordeal. That was something that stuck in my mind for many years to come. And then subsequently, there are many different stories of women in very disadvantaged situations that I've seen through the many, many mission trips that I've done. And that keeps me wanting to go back to do some more. As a young person, chasing the dream is important, but firstly, don't forget why you're doing it. Do you believe firmly in what you do? If you do, are you practicing that? Are you a living example of what you're preaching? And I think that's really a good starting point. Yeah. Having a passion is important, but beyond just sort of passionate about the specialty or a work or a choice, one needs to start with a good passion for life, right? If you enjoy life, if you respect life, if you live life to the max, to the best of your ability, then you're in a really good position to be the best, whether it's obstetrician or whether the best surgeon or the best doctor or the best teacher, be the best version of yourself first, and then you can impact other people. I'm wishing everybody happiness and health. Stay safe, stay sane, and stay smiling.